Hello, I'm going to be doing my ABG draw. I'm doing it on this banana because I practiced on her arm quite a few times, but then I forgot to take my last video with the arm. So this is what we get. All right, so first things first, I would have my hands washed. I'm already gloved. I would introduce myself and let them know I'm from the respiratory department, verify the patient's name, and then I would explain to them a little bit what an ABG is and what we're looking for with the ABG and ask them if they have any questions and try and make them feel as comfortable as possible. So, next thing I would do is palpate for a pulse, and I would do it on both arms. Ideally, I want to use the non-dominant arm. Okay, and then I would have the patient flip their palm upwards and I would perform the Allen's test. And then I would remove my finger from the ulnar side first. Okay, and then I would go ahead and start. So I'm going to take my needle out first and withdraw it to the desired amount of sample that I want to use. That way it's ready to go. I have my gauze here, my Band-Aid, my alcohol. At our hospital, it comes in this little kit and everything is in there. So I have that all ready to go. All right, so I'm gonna cleanse the area in a circular motion for 30 seconds. Okay, gonna make sure I have my pulse. Go ahead and grab my needle. Uncap this guy. Okay. Then I would place this hand into the palm of my patient to kind of brace their hand down. Okay. I'm gonna go in at a 45-degree angle with my bevel up and say big poke. Okay, wait till my sample is filled up and remove. I'm gonna go ahead and cap my needle, holding pressure. And while I do that, I'm gonna flip this upward and cap it. I'm gonna go ahead, grab my Band-Aid, make sure that there's no bleeding or swelling, and I'm gonna Band-Aid them up. My sample is capped. And then I'm going to put it in the lab bag and send it off to the lab with the correct labels. That's it.